HIV or human immunodeficiency virus is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases. It is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex or through sharing injection drug equipment. AIDS, or acquired immunodeficiency syndrome, is the late stage of HIV infection that occurs when the body's immune system is severely damaged because of the virus. Without HIV medicine, people with AIDS typically survive for about 3 years. Sexually transmitted infection or STI is transmitted by sexual intercourse, using of infected needles, mother to infant transmission, and blood transfusion of infected person to a non-infected person. STI can have a range of signs and symptoms, including no symptoms. That is why they may go unnoticed until complications occur or a partner is diagnosed. Signs and symptoms that might indicate an STI include sores or bumps on the genitals or in the oral or rectal area, painful or burning urination, discharge from the penis, unusual or odd-smelling vaginal discharge, unusual vaginal bleeding, pain during sex, sore, swollen lymph nodes, particularly in the groin but sometimes more widespread, lower abdominal pain, fever, and rash over the trunk, hands, or feet. Signs and symptoms may appear a few days after exposure, or it may take years before you have any noticeable problems depending on the organism. How to prevent STI? First, get the facts. Do not immediately believe statements found on the internet or stories from people. Rely on factual, scientific, and research-based knowledge. The second is take control. Practice abstinence from sexual intercourse. The most reliable way to avoid infection is to not have sex. Next is use of medically prescribed intravenous drug. Vaccines are safe, effective, and recommended ways to prevent hepatitis B and HPV. Reduce number of sex partners. Reducing your number of sex partners can decrease your risk for STIs. Mutual monogamy. Mutual monogamy means that you agree to be sexually active with only one person who has agreed to be sexually active only with you. Last is use condom. Correct and consistent use of the male latex condom is highly effective in reducing STI transmission. Importance of family for a person with STI. The family should express support and love. The family should provide influence in the self-confidence and self-esteem of an infected person. The family should have open communication that leads to the positive mental development of the infected person. And lastly, the family should give moral support to make the infected person continue living a normal and worthy life.